Well, we knew that it was going to be a problem. Ethylene oxide, FDA wants to reduce the amount. We've talked on the show any number of times about the new guidances from from EPA. Let's try that again. New guidances from EPA. But of course, medical device advocacy groups coming out and saying, slow down, we're not saying that we love ethylene oxide. We're just saying that that's how an awful lot of your medical devices get sterilized today. Hold on, let's balance these competing factors. And the good news is that FDA had announced in April a radiation sterilization master file pilot program. They are doing other types of sterilization. They've got a whole list here. Moist heat, dry heat, radiation, ethylene oxide, vaporized hydrogen peroxide, other sterilization methods. They're just kind of open to all these things. And both for 510Ks and for PMAs, FDA is trying to get methods cleared such that you won't have to submit for a new device clearance if you have to change your sterilization method. So let's say you're a manufacturer and you're out there and you're using a traditional ethylene oxide cycle and it becomes unavailable to you and you just can't get your product out there. Are you dead in the water? Do you have to stop? Do you have to revalidate your entire product through some other method and then resubmit to FDA for clearance? This is where the sterilization master file comes in. Because if there's a master file that really has characterized this new sterilization method, FDA is trying to make it possible that certain devices can switch over and not have to resubmit. So that's really, really good news for companies that might find themselves in that space. Now, this is a page that's got a lot of other information. We're not going to touch on all of it. I think we've showed this page before from FDA's website. What is interesting down here, having announced these master file programs, here's the 510K ethylene oxide sterility change master file pilot program. This was May 2022 that they announced this. So if you had a established category B or novel sterilization method, you could be part of this. Now, there were a bunch of companies that were part of this for PMA holders. A bit of news here that I want to get you to. Let me see if I can find it here. Well, of course, we've been through this before, but now we're not going to find it. It's up the page here. Oh, there it is. Almost lost him at the bottom. Anderson Scientific, just a week ago, got FDA's nod for their flexible chamber ethylene oxide sterilization method. And it actually makes a lot of sense if you think about it. It's still using ethylene oxide, but the way they're reducing the amount is they have a flexible chamber. And the flexible chamber can fill up with ethylene oxide, but it can then be collapsed down so the ETO can be retrieved instead of just vented into the atmosphere. So Anderson has this. They've got a master file with FDA. That means some relatively good news that people who are using their method now will hopefully not have to resubmit for a 510K if they need to change sterilization methods. So I guess if you're out there and you've got a 510K and you think you're going to have to change your sterilization method, there may be hope on the horizon. And of course, there's other methods out there as well, methods that use supercooled gases and things like that. And I'm sure we'll hear more about those as time goes on and this master file program continues to progress.